Alright, this is Janus Banana. So let's look about the dead space and the shunt. Here are the very basic point that you need to know. The structure of respiratory tract, it is divided into conducting portion and respiratory portion. The respiratory portion is for gas exchange, while the conducting portion cannot undergo gas exchange. And another very basic concept is VQ ratio. V means ventilation, Q means perfusion, and VQ ratio is normally around 0.8. Alright, so you've already know the very basic concept. Now let's look at the dead space. Dead space means there is an increase in VQ ratio. So there are different type of dead space. Here we are going to talk about the normal dead space. The first one is anatomical dead space. This means that the air within our nasal cavity, within our trachea, our bronchi, our terminal bronchioles, they cannot undergo gas exchange. So this is the anatomical dead space. The second one is alveolar dead space. This means that normally some of our alveola cannot get air perfusion. So there is alveolar dead space. The third one is physiological dead space. This is the sum of anatomical dead space and alveolar dead space. So whenever you are taking a breath, there is always a portion of our airway that cannot undergo gas exchange because it is lack of perfusion. Alright, so let's move to the shunt. Shunt means there is a decreased VQ ratio. So a shunt means that there is no ventilation or very poor ventilation while the blood is still getting through this area. So normally our lung is supplied by not only pulmonary artery but the bronchial artery. So maybe part of the blood in the bronchial artery may go into the pulmonary vein without going through the pulmonary capillary. Means that this portion of blood is not getting gas exchange. Alright, so this is a shunt. Let's move to the comparison of the shunt and dead space. Here is a very clear demonstration, a very clear comparison of these two. You may review this after you finish this video. Let's move to the pathological dead space. A pathological dead space means there is an abnormal increase in VQ ratio. This may be caused by pulmonary embolism, means that there is any kind of substance, maybe a blood clotting, that is blocking the pulmonary artery. So that part of lung, although you can still breathe, although it's still ventilating, but it cannot get blood perfusion, so no blood is going through that part of lung. Can it undergo gas exchange? No. The second one is pulmonary infarction. This means part of the pulmonary artery is blocked or somehow. And the third one is emphysema. The fourth one is shock. So here we are talking about the emphysema. We know that emphysema is destruction of alveolar wall. We know that the alveolar wall contains what? Capillary. For what? For gas exchange. So if we destroy the alveolar wall, although the capacity, or we say the volume of the lung is the same, but because the capillary within that wall is destroyed, so that portion of space is getting insufficient perfusion. So that is the cause of that space. Of course, somebody may say emphysema may be seen in COPD, chronic obstructive pulmonary disease. This means that there is constriction of the distal small airway. So that part of alveoli is not well ventilated. Yes, that part of alveoli is not well ventilated, but that space also exists in emphysema. So let's look at the pathological shunt. Pathological shunt means there's a decrease in ventilation or abnormal increase perfusion. This may be caused by any kind of problem that can block our airway, maybe pneumonia, the consolidation, maybe airway obstruction by a candy, or pulmonary edema, which is caused by congestive heart failure. usually of left heart. Maybe it's caused by atelectasis or hyaline membrane disease because the surface tension of alveoli is getting too large. So the alveoli start to collapse. Once it collapses, can it get air? No, there's no ventilation there, but the blood is still flowing through. Also, you may get abnormal vascular connection, maybe some arterial AV fistula, means that the blood directly go from the arteriola into the venula. All right, so this is a very basic point of the dead space and shunt. Thanks for watching. Because from my accent, you may know that I'm a Chinese medical student and I'm studying medicine in English. I got lots of questions, lots of problems with all kinds of physiology because our teachers is not teaching well. I have to search all kinds of information within YouTube or Google it. So here I hope that by my small effort I can help more students understand medicine in English better. So I'm just sorry about my poor oral English. If I'm not getting clear, and anywhere you may just comment and ask, and I will try my best to reply. Thanks for watching. Thanks.